Before I outline the aims and structure of this event and also introduce our first speakers, I'd just like to take a moment to introduce you to the work of the MIDEQ Hub. You'll have seen before we started some rolling slides, just giving you a flavor of some of our work. MIDEQ, which stands for Migration for Development and Equality, is one of 12 global interdisciplinary research hubs funded by the UKRI Global Challenges Research Fund. And it is really funding it's one of 12 hubs that are aimed at producing research to help a wide range of actors tackle a range of challenges facing the world today. And since early 2019, we've been working with a team of more than 120 researchers across the global south in 12 countries, as well as in the UK, to better understand and address the relationships between migration, equality, and development in the context of the global south. We're now in the final year, or rather the final 9 months of the project, and we have a huge number of publications and events lined up, of which this is one. And you can find out much more about our work at our website, which is www.mideq.org. And so to the focus of our event. In recent years, social protection programs have multiplied globally, with most countries in the world now having at least one social protection program. And as global expansion in social protection continues, so does policy interest in the different, sometimes inadvertent effects of this expansion. And one of these potential effects lies in the interaction with migration decision-making. For example, is there a link between access to social protection and the ability or need to migrate? With this interest in the relationships between migration and social protection comes the risk of policy assumptions that think that instruments like social protection can be used to potentially stop or reduce migration. So in this roundtable, what we want to do is to really explore the relationships between social protection and migration and to consider the implications for policy. And the discussion that we'll be having today draws upon both a MIDEQ working paper that was published earlier this year and a UNUCPR discussion paper, which was published today. And the link for that paper will be provided in the chat. So in terms of the structure of the roundtable, what we'll do is start with a presentation on the state of the evidence in relation to social protection and migration in low and middle income countries, drawing on the work published that I just described. And then we'll have a conversation between one of our researchers and Rogelio Grados, who's the director or previously director of the Mexican Oportunidades program, who will be able to tell us a little bit about the effects of the program on migration and the implications for social policy. And finally, we'll have a final speaker, this time from ILO, reflecting on the social protection and migration link from the perspective of the ILO and international human rights standards. And we'll then open up the discussion to you. You can either type your comments or questions in the chat, or you can sort of raise your hand, literally, or wave at us in order that we can take your questions and comments. We'll take questions in groups so that our panelists can respond. So without further ado, having set the scene, I'd like to really introduce our first speakers. Welcome, Jessica. Welcome, Jason. Jessica Hagen-Zanker is a senior research fellow leading ODI's migration research, and she also leads MIDEQ's work package on migration decision-making, information, and perceptions. Jessica has designed and delivers numerous household surveys and has extensive mixed methods data collection experience in South Asia, Sub-Saharan Africa, and the Middle East, as well as expertise in systematic literature reviews. Jessica holds a PhD in public policy from Maastricht University. Welcome, Jessica. Very happy to have you here. Jason Gagnon is Senior Development Economist with the OECD Development Center and heads its unit on migration and skills, producing empirically based policy reports and coordinating its policy dialogue on migration and development, and co-chairing a NOMAD thematic working group on special issues. Jason also works very closely with MIDEQ on behalf of the OECD Development Center, which is one of MIDEQ's international partners, alongside IOM, ILO, UNRISD, UN Human Rights, and UNUCPR. Jason holds a PhD in economics from the Paris School of Economics. We're really delighted to have you both with us. We're really looking forward to your synopsis and summary of the work that you've been undertaking and published today. I believe you're going to share some slides and that you've got 20 minutes for your presentation. Thank you very much. Look forward to your comments.
I assume you can see my screen now? Okay, great. Good afternoon, everyone, or good evening. It's really a pleasure to finally share the findings of the research we've been doing as part of MIDEQ on the links between social protection and migration. So this is a paper or a series of papers I've been working on with Carmen, a colleague at ODI, and with Jason. And I'm going to introduce the paper to you, explain what exactly we did and what our main headline findings are before handing over to Jason, who will go into the findings in a bit more detail. So just to briefly situate the paper is part of the work package on migration perceptions, knowledge, and decision-making. So it's one of the overarching themes of MIDEQ. Today, our presentation will be mainly based on the UNU CPR paper, which was launched today. And if anyone's interested in the more detailed version, you can go on the MIDEQ website, where we have a much longer MIDEQ working paper. So just to give you a bit of context why we started looking at this issue, we all know that the drivers of migration are very complex, they're multi-layered, they're context specific. The drivers of migration is, of course, also something we look at within the project, and particularly in my work package 4 on decision making. And through the other work we've done, we know that the drivers are political insecurity, conflict, more subjective factors. But what we were particularly interested in this paper is the need to manage a broad range of risks. So, for example, managing risks such as job loss, or even things like raising a family. And then when people are faced with these risky environments and difficult circumstances, potentially poor prospects, they then have to decide how they deal with these risks and circumstances. And migration can be one of these ways to deal with this risk, but many people don't have the aspirations to migrate, or they don't have the capability to migrate. But even if they could, many people don't necessarily want to, and there are many other ways of dealing with these risks. And one is social protection. So social protection, just to give you a definition, are publicly mandated actions that seek to address risk and vulnerability, often amongst poor or near poor households, and they include interventions such as pensions or child benefits, unemployment benefits, or public works programs. And social protection mechanisms have been expanded all over the world. Previously, we mainly saw them in high income countries, but in the last 10, 20 years, they've expanded also across low and middle income countries. And most countries of the world have at least one social protection program now. And given the importance of risk in the decision to migrate, access to other coping mechanisms like social protection can, of course, in theory, affect the decision to migrate. And then alongside this expansion of social protection programs, we've seen that there is now an interest in what are some of the unexpected side effects of this expansion? Do they potentially affect the decision to migrate? And in our paper, we really wanted to explore this relationship and these underlying assumptions. Especially because, as Heaven already mentioned, there's also a danger that social protection programs start being labeled as interventions to stop or prevent migrations. So we really wanted to explore some of these simplistic assumptions. So in our paper, we conducted a literature review where we looked at all of the relevant literature on this topic that we could find. We really tried to make it as encompassing as possible. So we looked at qualitative literature, we looked at quantitative literature, we looked at gray literature, but of course also literature published in journals. And we focused on low and middle income countries to rebalance an analysis that has been done so far, and to really look at the underexplored literature. We had a search protocol and also conducted formal searches in journals using predefined search strings to really make sure we get as efficient and as good searches as possible. And we also searched in French and Spanish so that we can also find literature published in other contexts. And we did, in fact, find some really interesting evidence by expanding the language criteria for our searches. And in the end, we found 76 papers that met our search criteria. Just to let you know, about 10 years ago, or even longer, Carmen and I did an earlier study on this topic, and back then we only found 29 papers. So the interest in this topic has really expanded. And these 76 papers covered 85 countries, interventions in 85 countries. So the evidence base is global. We do find studies on all areas of the world, but it is very skewed towards Latin America and the Caribbean for a number of reasons. One is that's where we saw the first big expansions of social protection programs, including, of course, most famously Oportunidades, which we'll hear a lot more about. But also a lot of these expansions were accompanied by really strong monitoring and evaluation and data collection. So they just also happened to be studied more. And half of the studies included are dominated by 4 countries. So we, for example, have 28 studies on Mexico, 10 on India, and 5 on South Africa, and 5 on China. In terms of the key findings, how does social protection affect migration? There's no clear picture. Here, the 4 bars basically show whether social protection had a decrease, an increase, a mixed impact, or no impact on migration. And you can see the bars are all quite similar heights. So there's no clear picture, and we cannot say upfront whether access to social protection leads to an increase or decrease in internal, international, or temporary migration. We found, you might be wondering what the mixed outcomes column refers to. So mixed outcomes are those studies where they, for example, found different effects over different time periods. So first an increase, then a decrease, or an increase for some members of the household and a decrease for others, or differences between different regions. And you can see that column is just as important as the increase or decrease. And we also found that 11 studies that found no effect for this relationship, or no statistically significant effect. So basically saying migration is actually not linked to social protection in any way. So of course, this aggregate picture actually doesn't tell us that much, and it hides more specific underlying trends. So this aggregate picture lumps together different types of migration, different types of social protection program. And in our paper, we disaggregated this, and it gives us somewhat more interesting and meaningful picture, which Jason will now talk to you about. And Jason, over to you. Please tell me when to move on to the next slide.
Thanks, Jessica. Yeah, you could move on to the next slide already. Okay, so as Jessica just presented to you, we took a general picture about whether a number of studies, 76 studies, looked at whether migration in the context of social protection increased, decreased, had a mixed result, or had no impact at all. We kept those 4 categories and then sliced it in a number of different ways. And one of the very first thing we did was look at whether this changed whether we looked at it, whether migration was internal to a country or whether it was international. And we took an additional step and looked at the papers that spoke more specifically about temporary migration, which, as you can imagine, is a bit methodologically a little bit more complicated, but this is the way we looked at it at first. And we did this for a number of things. And the next 5 slides is speaking to the ways we did this. We, as you can see from the slide in front of you, we didn't see any consistent finding on whether internal or international migration were driving the general results that Jessica mentioned earlier. And this was a first finding for us, because you could imagine in internal migration, it might be related to a number of things related to itself, to social protection. Maybe it's the historical context of, or the timing of where the country was at the moment. Maybe it was the fact that there's a certain level of urbanization in the country, and internal migration is primarily, in the papers we read, primarily rural to urban, so it was a part of the urbanization process. Was this something else related to a specific country that we might not be able to understand, but where we see a consistent finding in that country specifically? None of these things seemed to explain what we were finding, and that was true for internal migration. But as you can see, it was also true, even to a lesser extent, but it was also true for international migration, where we found the impact of a decrease being a little bit more prominent than increase. And that might be explained by the fact that international migration requires a lot more constraints. And so maybe the fact that social protection comes in and reduces those constraints actually did the opposite of what you'd expect, and decreased the need to migrate in the first place. In terms of temporary migration, we find the opposite. We find that there's a slight higher result towards increasing migration. And so it seems to be that in the context of social protection, there are people that are able to migrate more, or that the financial constraints that Jessica mentioned earlier are decreased, but it doesn't lead to permanent migration. It leads to circular movements where people move and then might come back, either for family reasons or because of seasonality of the underlying migration. But generally, we didn't really take away a big headlining result from this slice. Next slide, please. So the next natural thing we looked at was to slice our different social protection programs by their types. And this way we did across 5 different social protection systems or initiatives or programs. We have CCTs, conditional cash transfers, like the Oportunidades program that we heard Jessica mention and that we'll hear about later. We had unconditional cash transfers that are given unconditionally without any counterpart from the receiving end. There are non-contributory pensions, social and health insurance, and then public works programs, programs that are transferred often in terms of actual employment to people in return. And here, as you can see, realize that after the color scheme is not the same as the first slide. The yellow here is mixed outcomes. So really focus on, if you want to see the difference between programs here, really focus on the black and the gray, which are decreased and increased. And as you can see, in terms of CCTs and UCTs, unconditional and conditional cash transfers, we really don't see much difference between an increase or a decrease. We see a lot of mixed outcomes, which adds to the more generalized outcomes that we find. Where we did see something different, even though there aren't, it's the number of observations here is not enormous, is on non-contributory pensions, where we saw lots of increases in migration. Lots of different reasons about that, but what's really interesting about the papers that spoke about that is that it's maybe obviously, it's never the person actually receiving the pension that migrates here. This is constraints that are lifted at the household level and that allow someone else from the household to migrate. And a lot of these papers are based on South Africa, but there are a couple of others. But it's quite interesting that it really lifts the financial constraints that Jessica mentioned earlier, to migrate internally, mostly to the country, and often also temporary. Although we didn't slice it to that extent because of the way, because of the number of studies we found. As you can see, for the rest, the study numbers are so low for the social and health insurance programs that it's hard to take something away from here, but we do find that insurance programs do seem to tend to decrease or have no impact on migration, which is an interesting and an opposite, a different outcome from the pension outcomes. And then on the public works programs, here we find that there's a slightly equal impact across all of the different outcomes here, and the increase maybe slightly more on the decrease side, but it's really just one or two studies more, so it's really something that's rather inconclusive. So again, slicing things this way, trying to distill some sort of understanding or finding was quite difficult, and we came away with nothing which was overlyingly conclusive. Next slide, please. So I'm not going to show any more figures because then we would never end, and we would just show you a number of figures. But I do want to speak about other things, other ways that we've looked at this. And we've looked at whether there were reasons to find the outcomes that we did find based on individual and household characteristics. And on the individual side, one thing that did come out was on skill and education and on age. So as skill and education increased, we found that migration also increased. And we found the same thing, well, with age, we found that it naturally increased, but that's because we're naturally looking at people that are of major age. But we probably, if you were to include the entire age spectrum, you'd find some sort of inverted U shape finding. The findings that we looked at in terms of gender and ethnicity, specifically on ethnicity on indigenous people in Mexico, were rather inconclusive and were difficult to say anything about them. But in the sense that there were increases and decreases, but we did go in thinking that maybe in cases where gender norms didn't allow women, for instance, to have the agency to be able to migrate on their own, we might find that migration is decreasing in those cases, but it wasn't really conclusive in those sense. On the household level and on the characteristics of households, naturally we found that the number of children decreased the amount of, or the propensity to migrate, and that's natural for a couple of reasons. One is that when you have children at home, somebody must stay at home to take care of them, but also because a lot of these programs that we looked at specifically have children in mind, and the reason that the transfers are made is to take care of their health outcomes or their educational outcomes. So this seemed to have an impact on decreasing migration propensities. On the income side and the wealth side, we found that there was an interaction, which actually it seemed to be more likely that richer households would increase their migration propensities when they were richer. Just a bit of a deep dive, because we had so many studies. There's so many studies that are done on the Mexico program, Oportunidades. And it's interesting because, again, we look at more than just quantitative studies. We look at quantitative studies, mixed studies, qualitative studies, and we found that the impact of Oportunidades on migration outcomes were really mediated by things like hopes and dreams, and also plans to achieve mobility of beneficiaries. These were responses that were given in qualitative studies on why people migrated. So it was interesting to see the increases or decreases related to receiving the benefits of Oportunidades in the line of what people really wanted to do with migration. Next slide, please. I'm going to spend really a short amount of time on this because it's probably self-explanatory, but the attractiveness of a destination really mediated the link between social protection and migration. For instance, especially in the case of, for instance, Mexico and US, where you have a country right next door that is very attractive in terms of jobs, very attractive in terms of average wages. In some cases, an ease of migration, maybe not in the Mexico-US sense all the time, but in other parts of the world, the attractiveness of migrating often superseded the impact that social protection could eventually have in either increasing or decreasing migration. It didn't really matter that social protection was there. It was migration was a part of life. It was a prior experience with migration. These kinds of things really often were more important than the fact that there were social protection systems in place. Household level shocks was another one. In terms of, it didn't really often matter whether there was a social protection system in place. If there was a climate shock or some sort of shock, which it could be a death in the family, which led people to migrate to another country. And this, again, Procampo is a Mexico program actually related to Oportunidades. And again, lots of studies on this, and it's interesting to see, based on everything I just said, how, because it goes beyond the time and space at a specific moment. It really the size of the impact of social protection systems in countries, they change over time, they change over context. The costs and risks that are important to those decisions vary in a lot of over time in a lot of different contexts. Next slide, please. Okay, so this is the last thing I'm gonna speak about in terms of how we slice. We sliced things in a lot of different ways, but this was the final one that I want to speak about, and this was about really taking a step back and saying, okay, well, is the way that a social protection system or initiative constructed or designed, and the way that it's implemented, how does that impact the decision to migrate or not? And there were things that we revisited in a different way. For instance, whether there was a requirement of physical presence in the locality. For instance, in the CCTs, in Oportunidades, for instance, somebody must be in the household to receive the benefit, even if it's for the children. So receive it, and they have to go to they don't receive it at home. They need to physically go somewhere to receive that transfer and sign off on it. And there's also checks that are done by different authorities, making sure that the conditions are met. So obviously that is something that decreases the opportunity to migrate for, at least for the household, for the household heads or the old parents and legal guardians of the household. We didn't necessarily find that had a big impact, however, across the studies. But again, this was primarily based on the Mexico programs. We looked at target group and whether looking specifically at elderly or looking specifically at children or looking specifically at disability impacted the outcome. We didn't find anything conclusive there. Same thing with geographical targeting, because you could imagine if rural areas are targeted or urban areas are targeted, or what is more commonly the case, specific areas of a country are targeted early on, and then the program is expanded. Oportunidades was one of those cases, but it's true in most social programs that start off in that way. Whether that had an impact in as they expanded, whether the impact changed, or whether the impact was different when it was just focused on one specific locality rather than the national setting, that didn't seem to have much of an impact. We looked at the amount transferred, and this was a subjective feeling for the paper on how the author, him or herself, spoke about the amount, whether it was high or too low, et cetera, et cetera. We didn't find a link between how high that amount transferred and the opportunity to migrate transpired. The frequency and the regularity of payments, here we did find some consistency. We found that a payment that was more regular increased migration, which was not exactly what you might expect. And that one-time transfers didn't necessarily have any impact. And then we looked at type of benefits, but this is very repetitive to what we were doing earlier. On implementation, here we listed the number of things we looked at in different papers: capacity, corruption, data, duration. This doesn't seem to have any overlying impact. But I did want to speak about one thing, and that's and it has a lot to do with Oportunidades that we will hear about soon, but also as an idea bringing design and implementation together, which is, and it has also a policy impact, which is the impact that you might find between a social protection program and migration, specifically or especially if it's targeting children. In the way that we study this isn't necessarily going to have an impact in the months or even the very short years that the program takes place. And when we looked at the long term, and there are a few studies that do this, but when you look at all the studies that looked at the long term, and I'm talking like 15 years down the road, it's a lot of studies. They're very recent. They look at when Oportunidades was first implemented, and they look at where those children are today. There is an impact on the increase of migration. So the impact on migration through social protection programs is often unlikely to be a very short-term thing. It's especially when, Oportunidades focuses on health and it focuses on education. These are things that when transferred to someone, the benefits grow over time and increase their human capital, increase their opportunity to migrate, increase their agency. And so I think it's really, that's one of the important things that we did find from this paper as well. Next slide, please. So this is our last slide. And we end the paper providing some very overarching recommendations or implications that we think are important for policy. And one important one, and we start off with this, it's really about identifying whether this is important or not when you start designing social protection programs. And I hope we could get into this in the discussion. And I think it's really important to already speak about that, because it really happens from the very beginning, because these are, as have been said at the beginning, these effects are often inadvertent. And so putting together a social protection program and then suddenly finding that possibly you weren't necessarily thinking it would have an impact on migration, but in the back of your mind, you might have thought this was really to create the well-being of people in your country, and there are all these other impacts happening. It's really important to have those set when you do start thinking about policy generally. It also involves, or it requires an involvement of different sets of actors when you're designing, when you're implementing social protection programs. It's not just about social protection. It's about all of the line ministries in a government. It's about the local context. It's about agriculture, about gender equality. All of these different actors, depending on what the social protection program looks like, they should be around the table. And it's even, I think, often a good thing if they've never been involved in a social protection program, because they really come in from a blank slate of mind, thinking about the preoccupation, the concerns that are directly related to their field of expertise. It's about accounting for the structural context and the characteristics of the participants in those programs. And we spoke about that very quickly. We spoke about gender, about age, about education levels. It's about making sure that the social protection programs equip the individuals with those skills and the ability to reduce the risk if migration is part of those objectives. And finally, and this is the whole point of the paper, maybe, it's about monitoring and evaluating what these programs do to decision making in the long run, because it's really part of the outcomes of social protection programs beyond the very specific objectives of those programs. Thank you very much on behalf of Jessica and myself, and also Carmen, because she's also an author to this. I give the floor back to Heaven.
Wonderful. Thank you, Jason. Thank you, Jessica, and also Carmen, of course. I think it's very helpful to have the sort of summary of the paper and the main findings. I'm going to put two questions or two things for you to think about in the mix that we'll come back to in the question session. The first is really about the kind of issue of correlation versus causality, and how do you, or more specifically, how do the studies that we're looking at really know it's social protection that's making the difference in terms of the decision-making process, given the whole wide range of other variables that you alluded to. And the second question really, or second thing that occurred to me, comes on the back of your last slide, which is the extent to which social protection is being used as a policy to sort of manage migration, or whether, as you say, it's really a kind of broader strategy that then has migration consequences. Because I'm sensing from the way in which you're talking about these things that there's kind of an opportunity potentially, but also a danger in a sense that you have an instrumentalized way of looking at social protection. We're not going to go into those questions now, but I just want to park them in case they come up later or could be addressed by some of the speakers that we'll come on to. But thank you for the very helpful overview presentation. We're going to move on now. We've heard quite a lot today already about Oportunidades. We're going to have a conversation next between Carmen, who we've heard from already in relation to the paper, with Rogelio Grados, who was the director of that program, discussing the effects of the program on migration and the implications for social policy. So I'll just briefly introduce both of them first, and I'll hand over to Carmen to lead the conversation. So first of all, Carmen Leon Himmelstine is a research fellow at ODI based at the Gender Equality and Social Inclusion Program, and her research focuses on social protection, as we've heard, migration, rural livelihoods, health, and childhood poverty from a gender norms and intersectional lens. And Carmen has extensive research and fieldwork experience on this topic in East and West Africa, South America, and the Caribbean and East Asia, using a wide variety of research methods and approaches. And she holds a PhD in international development with a focus on social protection and migration from the University of Sussex. Welcome, Carmen. Very glad to have you with us. Rogelio Grados is currently the Director General of Planning, Monitoring and Evaluation at the National Coordination of Scholarships in the Ministry of Education in Mexico. But from 2010 to 2017, he worked as Director of the External Evaluation Unit at the National Coordination Program for Oportunidades, which we've heard was one of the earliest conditional cash transfer programs in the world. And during his post, during this time, he coordinated the design and implementation of medium and long-term external evaluation of the program. So I think you're incredibly well-placed, Rogelio, to tell us a little bit more detail about how this program operated and what its effects were. Welcome to you both. Very delighted to have you here. Carmen, over to you for the conversation. I think we've got about 15 minutes and we look forward to it. Thank you.
Thank you so much, Helen. So I'm going to start asking my first question, Rogelio, and we are looking forward to listening to your insights. So first, I would like to know, did policymakers consider the relationship between social protection and migration when Oportunidades was first conceived? Was it even on the radar? What do you think about it?
Well, I wasn't in those years, but my perception about it was that yes, migration was considered as part of the behavior of the households that were targeted from the program. But I think that the relationship between migration and the possible effects of the program changed over time. For example, my opinion is that, well, this program was prevailing in Mexico for a period of 22 years, from 1997 to 2018. And I think that we can divide the program in three phases. The first phase, the initial phase, we can consider it was from 1997 to the year 2000. And during this period, it was called Progresa, and it was centered in rural households, poor rural households. And the expectation of the program was to stay in functions for just this 3-year period, because it was the period remaining for the president in that time. So the expectations were very short-term expectations. Well, and the main expectation was that, well, migration was an effect of the poverty condition of the beneficiary households, and that the program may content the rural-urban migration of these households and the rural international migration, as it gave these households a minimum floor of income and access to basic services. And because of the conditionalities, well, it demanded the presence of the beneficiary in the location. So that was the expectation of the program, to content migration. But as the program evolved and gained acceptance, political acceptance, it entered into its second phase, which was when it was named Oportunidades, and it was from 2000 until 2014. And it was conceived in that period as part of a state policy of social protection that was built in Mexico during those years. So the program was strengthened, it expanded to urban areas, and also its components expanded and changed. The component that changed the most was the education component. We incorporated the scholarships to tertiary education, because in the first phase, the scholarships only covered primary education, which in Mexico accounts for 9 years of schooling. With the expansion to tertiary education, we added 9 years of schooling to the beneficiaries. And also we increased the amounts of the income transfers. With this and other changes in its design, the relationship between the program and migration changed, no? Because we were investing more in human capital, as Jason stated in his presentation. And when you invest in human capital, well, the expectations of the people change, and they seek more well-being, to achieve more well-being. So the expectation of the population changed, and maybe these changes may have induced some we may induce some migration, no? Because in Mexico the migration occurred not only because of the initial thoughts of the programs, because of poverty-related migration, but also because, well, as you know, there are some regions in Mexico, and there is some population in Mexico that live working in farming, and they have to move to another state in a regularly. They are known as jornaleros, so they live in some locations during the 6 months of the year, and in the second part of the year they move to work, and they do it regularly. That kind of migration we slightly changed, because they were incorporated in their localities of origin, and when they moved, they demanded the program, to have access to the program in their localities of destination. So we try to change the program to make it portable. But also there is a when the population changed the expectation of how many years they wanted to be in the school, we also force some migration, some internal migration, because in Mexico we have primary schools almost in any rural locality, but tertiary schools, they are concentrated in urban areas. So the children that look to have additional education and wanted to study tertiary education, they needed to migrate to another municipalities in order to have access to the scholarship and gain these 3 additional years of schooling. And that is because of how the schools are distributed in the territory in Mexico. And well, in the third phase of the program, which was when it changed to the name of Prospera, we started to do all these long-term effects research that Jason also named during his presentation. And in many of these studies, long-term effect studies, we confirm some of these hypotheses, no? That in the short term, maybe we contempt the internal migration for some groups. Maybe we have delayed the migration of the boys in some municipalities. But specifically, we induce some international migration because of the expansion of the years of scolarity on the children and the new expectations generated in this population, and they saw an opportunity to migrate to the US as an opportunity to exploit these new skills, these new, this increased human capital, and they move to the US. Maybe in later years, maybe more in the adulthood than when they were children, and maybe, and some of the evidence we gathered in those years confirm for some groups this hypothesis.
Thank you so much, Rogelio. I think you have answered already several of the questions that we had in mind, but can you tell us a bit these impacts of migration that you just described? Were policymakers or the internal group involved in the evaluations, for example, the scholars that you were working with, were they surprised and were they taken by surprise? And what did you see in terms of the conversation that you guys were having? And you already told us that there was a difference between migration within Mexico and to the USA, but is there anything else that you want to include about all the discussions that you were having in those days?
Yeah, maybe at the, when we started to study immigration during the second phase of the program, we were expecting to see that migration was stopped or maybe decreased. And we saw that it slightly changed. The terms in which the internal migration was occurring changed slightly. As I told you, the migration made by jornaleros continued, but they were interested in having the program in both sides, in their localities of origin and in their localities of destination. They wanted to keep the children in the school, and also they wanted to keep receiving the scholarships. And maybe with the second generation, some of the children that, some of the jornaleros' children may have stopped to migrate doing that kind of jobs and moved to another kind of occupation, maybe not linked to agriculture. Maybe they moved to another kind of labor, more related to services or more related to the industry. And there is some likely evidence about that. But in the medium and long term, the hypothesis of the effects of the program on internal migration through increased years of schooling were confirmed by some studies. Specifically, one of these studies made by Susan Parker and Tom Bogle identified that the earlier in their school trajectory the rural children were exposed to the program, the greater were the effects in years of schooling, labor participation, labor income, urban residence, and intermunicipal migration, particularly in women. So the effects of investing in human capital changed the behavior of the children, of those who were children when the program was introduced, and specifically in women, which typically had a more traditional role in these rural households in Mexico. And they started to have more years of schooling and an impulse to move to the market labor and to migrate to another municipality, and in some cases to the US. And in boys, the boys who migrated to the US, well, there are some municipalities in Mexico that have a tradition in immigrate to the US, and they have very clear places of destination. For example, people from Puebla or Chiapas migrate to Chicago and New York, and they have a network that allows that that flux of people. And before the program, the boys migrated at a very young age, but when the program started to work, the boys still migrated, but once they finished tertiary education. So we may not have contempt that kind of migration, but we changed the characteristics of the migrants. And maybe the benefits of the increased human capital are enjoyed not by Mexican communities, but, well, at least the people have an increased well-being through the program. So yes, I think that once we started to study the program and the effects of migration, we changed our perception of how the program affected this phenomenon.
Thanks, Rogelio. And have the learnings from Oportunidades influenced new policies, and in which ways, from your point of view?
I think that unfortunately the Progresa, Oportunidades, Prospera program was finished in 2018, and there is in Mexico nowadays there is not a similar program in existence. But now the government, the current administration, started a strong policy of scholarships. Maybe I could not say that due to the influence of Oportunidades, but I think that Oportunidades, and specifically the long-term studies, demonstrated that the stronger effects were on the education component. The increased years of schooling, specifically in women in rural areas, and that may have inspired to implement stronger scholarship programs in Mexico. That now is the situation. We have scholarship programs for basic education, which covers the 9 years of primary school. We have a universal scholarship programs for all the students in tertiary education. And in this program, the scholarship is received not by the family, but directly by the youngsters, the students of these schools. And we have a program of scholarships in bachelor's degree. Well, that kind of programs didn't exist previously, and well, we have now these strong scholarships programs in Mexico, and maybe that will be an inheritance of Prospera Oportunidades.
Thanks, Rogelio. And my final question is: this relationship between social protection and migration something that is even relevant to policymakers, and what should they do about it from your point of view?
I think that, well, in my experience and in my opinion, is that migration is a dimension that should be considered in any social program, because as these programs intend to improve the present and or future well-being of their beneficiary population, for some of them, its accomplishment might imply to migrate internally or internationally. So if you expect to increase the well-being of the people, of the persons, well, they might, for some, they might find that in another place where you find them. No? They might want to improve to their new set of skills. They will want to have greater level of living, and well, they might move. So migration might be an expected result in some social programs, and we must consider that.
Thank you so much, Rogelio. That was very interesting. And that was my last question. So over to you now, Heaven.
Thank you, Carmen, and thank you, Rogelio. I thought that was a really fascinating insight into the kind of expected, but also mostly it sounds unexpected consequences of a social protection program in the context of Mexico. It really struck me when you were speaking that there's a kind of irony here, is that often people migrate because of a lack of opportunities, and then particularly where education is at the core of the social protection program, it actually enhances human capital to a point where people are potentially more likely to migrate, in part because there is a kind of lack of opportunities for them in the labor market. So there's a kind of a disconnect between what they've managed to achieve in terms of their education, but what's then available to them in that space. But also, I think, obviously, in the context of Mexico, and you certainly alluded to it, those social networks of people who have become very familiar with and used to migrating almost as part of their kind of social identity as well, from certain regions to certain regions, that, the intervention of a social protection program won't necessarily change that, but may change the characteristics of it. For example, people leaving later. I thought that was a really, really helpful nuance into some of this discussion. So thank you very much for that. I'm sure we're going to come back to some of these points in the discussion and the Q&A, because I think they're very pertinent to the broader points that Jason and Jessica raised in the paper at the beginning. But for the moment, we're going to hand over, last but not least, to our final speaker. I'd really like to welcome Clara van Panhuys, who will reflect on the social protection and migration link from the perspective of the ILO and international human rights standards. Clara is currently working for the Social Protection Department at the ILO in Geneva, focusing on working with governments, workers, employer organizations to support the extension of social protection to migrant workers, to refugees and their families. And she's worked in a wide range of other roles and in other places, including Pakistan, South Sudan, the DRC, and the Thai-Myanmar border, very much from a human rights perspective. Clara has 2 master's degrees, one in law and one in humanitarian assistance. So we get a good sense from that of where you're potentially coming from to this topic. Clara, thank you very much for being with us. You have 10 minutes to make your remarks, and we're really looking forward to them. Thank you. We're not hearing you for some reason. I'm not sure why. Could be an issue with your headphones.
How about now?
It's perfect. Thank you.
Perfect. Okay, sorry. So thank you very much, and hello everyone. So I'll present the ILO perspective, or the ILO approach. The ILO is mandated to support the extension of social protection to all in need of such protection, including migrant workers and their families. The ILO is a rights-based organization and custodian of a number of ILO or international labor standards, conventions, and recommendations that include relevant provisions on social protection for migrant workers. Does not actually promote or discourage migration, nor do the relevant international labor standards. When the ILO's approach is rather that when people decide to migrate, they should be protected, and that it should be a choice. This is also aligned with the Global Compact. And also the ILO's priority is basically to close the coverage gap by expanding social protection to those that are currently unprotected. We've estimated this to be approximately 4.1 billion people in the world, so about 53% of the world population, and amongst them many migrants and refugees. This mandate and this priority of closing a coverage gap has been given to us by our constituents, so government representatives and worker and employer representatives. Has been confirmed recently at the International Labour Conference in 2021, and also at the governing body discussion in March 2022. So this is a bit where where the ILO stands. Also, the ILO, but not just the ILO, I think at different levels, including the 2030 Agenda for Sustainable Development, has recognized and acknowledged that access to comprehensive, adequate social protection contributes, amongst others, to reducing poverty, reducing or preventing poverty, inequality, also social exclusion, and that it fosters social cohesion. But then for social protection to really be adequate and comprehensive, and have a stabilizing effect on income, while also providing income security, it needs to cover all risks that a person can encounter over a life cycle. And it needs to be adequate and provided on a regular periodical basis. And so only when it's really adequate and comprehensive, the idea is that this will ensure that the decision to migrate will be a choice. That's the assumption or the theory of choice behind it. A note on the definition from an ILO perspective. When I mention social protection, or most ILO documents referring to social protection, refers to social protection as including schemes that are contributory and non-contributory. So this would include social insurance and social assistance schemes, including tax finance schemes and any other social protection measure, conditional cash transfers, etc. Just to be clear, because sometimes the definition can be used in a more narrow way or in a wider way. So in terms of extension of social protection to migrant workers, the ILO promotes an integrated and progressive approach. This approach has been recently validated by our governing body in 2022. And the approach is grounded in international labor standards, anchored in social dialogue, and it involves, should involve organizations also representative of migrant workers. This approach particularly highlights the need and importance of ensuring access to social protection based on the principle of equality of treatment between nationals and non-nationals. Equality of treatment with respect to social protection is a fundamental right and principle, and it's actually also an important economic strategy, or a sound economic strategy, to avoid social dumping, to basically create a level playing field in terms of access to the labor market for nationals and non-nationals, avoiding that employers have to can resort to basically cheap labor. And so to ensure that countries progressively build more effective and comprehensive and inclusive social protection systems, the ILO recommends a set of mutually reinforcing policy measures to close this coverage gap, which really is a priority. And the first one is, as I said before, is to build inclusive social protection systems based on the principle of equality of treatment. This not only for non-nationals on the territory of a country, but also for returning migrants and for family members remaining in the country of origin. Then very quickly, because I don't have much more time, the other policy measures that are mutually reinforcing. So first is to build social protection systems. Second would be to ratify and apply the relevant conventions and recommendations. The third one would be to conclude and implement bilateral and multilateral social security agreements. The third one would be to conclude and implement bilateral labor agreements. And then last but not least would be to also take complementary measures to address the practical obstacles that migrants face. A few words on this, because it also relates to what the study also refers to. We can see that it's indeed very important to address also practical obstacles to ensure the implementation of existing laws, schemes, and social security agreements. The ILO, but also our sister organization ISA, is receiving really increasing number of requests in that sense, in particular from countries of origin wishing to extend to their nationals working abroad. And we see a kind of mushrooming, let's say, of quick fix solutions. Often some of these unilateral measures like welfare funds or individual saving accounts that do respond to a social protection gap. But some of these measures, unfortunately, the responsibility really falls on migrant workers in terms of contribution and funding, whereas social protection should of course be shared responsibility. It should be based on solidarity, including intergenerational solidarity. So one more word also on awareness raising. What we've seen in the ILO, and we work quite a lot on this, and I think there's still a lot more work to be done, is raising awareness, making people around the world understand the benefits of social protection. The assumption is that the more you are vulnerable, the less you may think of longer term risks that you will encounter, you and your family. And this also for the need for social protection. And many, I probably don't even know or understand what that would mean, and why it would be beneficial for them. So this is a little bit the policy options that we promote at the ILO to close the social protection gaps. So most important to remember that should be to build inclusive, comprehensive and adequate social protection systems that are based on equality of treatment and based on solidarity and on the yes, that's what I would say. So thank you very much.
Thank you, Clara. Thank you very much. It's good to have the ILO's view on how to, well, the importance of closing the social protection gap, which I think is something that sort of is an overarching framework for the kinds of issues that we're looking at within MIDEQ in terms of reducing inequalities between migrants and non-migrants in particular. Thank you all to all of the speakers. We still have some time, quite a lot of time actually, about 50 minutes to take any questions, any comments. I raised myself a couple of questions at the beginning in relation to the points you were making, Jason and Jessica, about the correlation or causality, if you like, between social protection and migration. How do we understand that? How do we unpack it, given there are so many different variables involved in the decision to migrate? And also, I'm sure we'll pick up on these points that were raised in relation to the program in Mexico in terms of the kind of unintended and intended consequences of social protection programs of one kind or another. So you're very welcome to put your camera on and wave your hand, or to put your question in the chat, or indeed click on the reactions button and you can actually raise your hand electronically. Whilst we're waiting for people to raise their hands or make any comments, I wonder, Jason and Jessica, whether you wanted to come back and respond to any of the points that were made by any of our other speakers, and or indeed the questions I raised in my questions at the end of your presentation. You're welcome to take the screen if you wish to do so.
Okay,
Jessica.
I can start.
Yeah.
Unless
Jason,
Jessica,
did
you want to go, Jessica? Okay, me.
Jason first.
Okay, no, those are two fundamental questions, Evan, because they're both questions that we discussed often between the three of us on the causality issue. It's a really difficult 76 papers. It really gets difficult to get down to the details of every single paper and make sure that the causality that they're discussing is we trust it in a way. And the other thing that adds to that difficulty is that we're talking about we took all papers, academic papers that we could find that spoke about the issue, and there are econometric papers in there that exploit randomized control variable RCTs that use instrumental variables approaches to identifying the exact causality, and that are very careful about causal effects. And then we have also collections of interviews that ask causal links through them and then make inferences based on those. So you have two very different approaches to discussing the correlation and causal links between the issue. So it's, I mean, we basically took the word of the authors here that they were making, and most of them make the point that they're they're digging into the causal relationship between the social protection program towards migration. I'm thinking of different examples more on the quantitative side of things that authors have exploited or seized on to try to find that causal link, especially using instrumental variables. And some instrumental variables are like age cutoffs. Some of them are RCTs specifically. You know, you take 10 different villages and 5 of them get some sort of social protection transfer, a UCT, and 5 of them don't, and try to see if there are causal links. Those types of things are things we came across. But yeah, it's something we discussed quite a bit actually. And I take the point. So on your second point, I want to start by saying one thing, which is, so your second point was on the you know, about the fact that that this should be an objective, that we're you know, are we careful about the fact that the outcomes here are policy oriented and so on and so forth, and whether we should be whether this could be exploited, I guess, in a negative way, from what I understood from your question. I want to start by saying that most studies, to recall what Jessica presented at the beginning, are internal migration. So it's really something that's not necessarily as controversial or as politically debated, I think, as international migration. Most studies are about internal migration. And the other thing is, some papers go out and rarely say that the objective of this program, and one of those programs is the India program on jobs. They readily say that the objective there is to reduce migration, and so it's something you can evaluate, and so it's really something that can be discussed. On the international migration side, sorry, just to finish on the internal migration first, I have a couple more points. One is, I think on the internal migration side, it's whether it's an objective or not is one discussion. The other thing is, I mentioned this right at the beginning, some of these countries are undergoing an urbanization process, which is still incomplete and is still ongoing. And you know, we're talking about some countries that have about 50% urbanization rate across the country, which is particularly low when you compare the world average. So this is really something about maybe the natural process of the development pathway that they've taken, and so it's really hard to say. Maybe these programs have accelerated the process or have changed the pathway of that, but it's something that was already ongoing. And I found it super interesting to go back to what Rogelio was saying about the fact that, again, about this natural process of related to urbanization and related to internal migration, where he said, you know, we transferred some human capital to these children who then grew up. Their human capital was higher, so they ended up finishing high school, and all of a sudden they wanted to go to university, and those universities were in cities. Of course they're going to migrate. A lot of them are from areas where there are no universities. So it's really, there's a logic to that, which was related to social protection, but is also natural. And then on the international migration side, I mean, I want to make it very clear, none of us think that these programs should be, you know, stopping migration. This is really, we're taking this from a neutral point of view. What are these papers looking at? What do they find? And whether there's an impact on social protection with migration or not. And then you can make whatever inference, political inference you want with that. But it's the starting point was, is social protection influencing the decision making behind migration?
Thanks, Jason. And I think that sort of theme of, you know, the danger of separating out migration from broader processes of social, political, and economic change, which are kind of continuing and provide the context within which migration decision making takes place. I think that's a big theme within MIDEQ more generally, and should indeed be a theme in more research, because the separation out of migration as a process from labor markets, from education, from urbanization, from all of these other elements seems, you know, well, just seems inconceivable, having looked at the complexities of these things, and yet it still continues. Jessica, I'll come to you, and then I might go back to Rogelio, if that's okay, because I want to ask him something more about the program in the Mexican context. But Jessica first, if you'd like.
Yeah, maybe just to add to what Jason has said and what I agree with. On the second question first, I think as I was listening to Jason present the second part of our paper, but then also when Rogelio was talking about the different phases of Oportunidades, it just made me think how ridiculous almost that premise is, that you can use migration to directly, social protection to directly influence migration. And I was thinking a lot about actually the timeframes and the different stages and almost the multiple layers of impacts over time that can contradict each other, change things, and also I think our findings showing that it really depends. I think the analysis we did where we looked at how are these impacts mediated by different characteristics at the individual household level or context level, it just showed that it really depends, but especially also that change over time really struck me as really important. So it definitely cannot be seen as some kind of short-term fix and you just throw a social protection program in there and then people are going to stop migrating. And I think the one thing our study does show, despite all the mixed findings, we don't have a clear picture, I think it does show no, that approach certainly doesn't work. So I would say that's one very clear finding. And we did also look at is migration part of the official objectives of these programs? And as Jason mentioned, there were a few exceptions, like the MREGA program in India, but most of them did not. And as Rogelio said, also not really in Mexico. On the first one, in terms of how, where Jason helpfully explained the range of studies we had and that we couldn't really dig into the detail of all of them. I just wanted to add one small thing. We did have a kind of minimum quality criteria for the studies included, and we excluded all studies that did not talk about their data or methodologies in detail. And those that did try to explain why this is the kind of why they did try to isolate the effect of social protection or how they did that, then we took them at face value. Thank you.
Thanks for that clarification, Jessica. That's very helpful. I've got two questions waiting, but I'm just, before we do that, just going to come back to Rogelio, if I may, because I interpreted what Rogelio was saying slightly differently, Jessica, than you said, because I thought that you said, Rogelio, that actually migration was one of the criteria for the program in some way. Do you just want to clarify that point and see whether I've misunderstood or in what way migration was kind of built into the thinking behind the program?
Yeah, well, the context in which the Progresa Oportunidades Prospera started was in 1997. We were recovering from a very deep economic crisis that happened at 1994. And in that year, also we had a surge with the Ejército Zapatista de Liberación Nacional in Chiapas, an army of indigenous people that declared the war to the Mexican state because of poverty. And also in 1994, NAFTA started. So during that period, there were occurring a lot of things on the economic side, but also on the society. And one of the responses of the government in that time was to design social programs that might prepare the people to the economic changes that the NAFTA was going to induce in the economy and in the society. That's why Progresa started in rural areas, because in the initial diagnosis, those were the households that had the very least human capital accumulation. So, and also the all the agriculture economy was to be changed profoundly, deeply by NAFTA. So they accompanied the Prospera with this program, Procampo, in the rural areas, in order to increase the human capital, but also to increase the income of these households and to retain them or try to retain them or try to reduce the immigration that might occur if nothing was done. So in that context, immigration might be conceived as a result that wasn't very desired to occur, no? Indirectly to inhibit.
Yeah, Rogelio, that's really helpful contextual information, just again explaining where that program came from. And also the fact that, the human capital is a resource for a country. If you lose that capital and the potential it brings for your economic as well as your social development, then clearly, that has consequences for economic development. And obviously your point that you made earlier in your presentation or your conversation with Carmen about the loss of people who migrate where the cost of education has been provided by that particular state. So, the global north is often benefiting hugely from social protection programs that have been expended by global south countries, which they then subsequently gain from. So that's really helpful. Thank you. I'm going to read out 2 questions online and also ask Katja to give us her question. And we're going to take these 3 questions together and then come back to each of you for a response. So another Clara de Camp says, on the internal migration studies, was there a correlation between the accessibility of social protection programs in rural areas, the impact of sparse social protection registration points, etc., and the flows of rural to urban migrations? That's a question, I guess, for Jason and Jessica specifically. Another question. Hello, everyone. My name is James Jumba, a social protection specialist from Kenya. Welcome, James. Very happy to have you here. My question is directed to Clara, particularly, and any of the other speakers. I'd like to know about the work of the ILO in promoting portability of social security benefits for international migrant workers, and how ILO conventions such as 97 and 143 help in supporting this endeavor. I know less about those conventions, so Clara, you might want to also explain what those conventions are when we get to you. First of all, though, we're going to go to Katja. Lovely to see you, Katja, again today. If you would like to give your question and direct it to which of the speakers you would like to answer it, and then we'll come back and take a round of responses. Screen is yours.
Yeah, thank you very much. And thanks to all the speakers. This was very, very interesting. Also, the particular example from Mexico, I think, very insightful. I was thinking when I listen to all of you, and also the ILO perspective, which, lays it out very clearly, I think, to say, only when we have adequate and comprehensive social protection, then we can talk about, migration really as a free choice and not driven by, very clear livelihoods, constraints and poverty and so on. And I think the fact that in a lot of low and middle income countries, social protection measures actually increase migration. But when we look at, the rich countries where we have the most comprehensive social protection systems, we have actually quite low rates of migration. So there seems to be, what Jason said, there seems to be like, there must be some sort of inverse Kuznets curve, that something that increases, as long as social protection and the labor market situation is not providing a really, decent life for citizens and, and people living in a certain country, they will still consider migration as a very necessary and attractive, alternative livelihood strategy. And when you reach a level of income and development and access to social security, that offers you a completely, good opportunities in your own country, there will be much less people who will actually migrate. So there is, our discussion has much to do with, the particular situation in many global South countries. But overall, I think what you showed, from the different examples and studies is actually, quite a positive picture. And, you know, I think I was just thinking, you know, we could use it in terms of, you know, a positive narrative about social protection and of migration. You know, one could kind of combine the evidence that you have showed to do what we are trying to do in MIDEQ, to create a positive narrative around, you know, that migration is an option and should be accessible to all. And on the other hand, how can we make it, you know, more human, more grounded, you know, and low risk and really good opportunities for those who engage with it. And the fact that in Mexico, for example, the social protection programs has increased the age of out-migration, right, of migration, it is a very positive sign, right? Because last year I was in Oaxaca and you know, and talking to communities, and they still said that after COVID, when a lot of young people dropped out of school, now due to the COVID crisis, you know, again, very young adolescents started to go to the United States, which again shows, you know, how important a stable educational system is in order, you know, to keep children as long in education as they really have, you know, a mature age to be able to migrate. So there is this positive story about social protection. But yeah, we have to make sure that it's not used in a way as a migration control instrument. And I was wondering whether in your studies you have also come across these examples like China and Vietnam, you know, or even Ethiopia, where they had also the productive safety net program also as an instrument actually to prevent internal migration. They wanted to keep people in the rural sector. You know, is there, which was, you know, I mean, is debated a lot because it kind of puts a lot of constraints on people, you know, even to move within their own country. And the same with the hukou system in China and a similar system in Vietnam. So, you know, have you looked into this and what it means for citizenship rights and for, you know, the kind of free choices that people have to move within their country or beyond?
Thanks, Katja. Really interesting observations around narrative, and also that point about restrictions on movement. I think in MIDEQ's work around what we're calling stay back children, this particularly in the Chinese context is very clear in relation to the literature, because parents are moving without their children precisely because they can't, because of a lack of portability of the social protection that's available to them in other districts that they're not registered in. So this is leading to a very significant increase in stay back children. It's something like 630 million stay back children in China as a consequence of that particular restriction. I wonder, Jessica and Jason, first of all, whether you'd like to respond to the internal migration point that was made in the chat by Clara, and also anything you wanted to say in relation to Katja's observation with regard to either the narrative or restrictions on movement. Jessica, do you want to go first?
Yeah, I'll go first, and I think I'll leave the internal migration question to Jason because he has a better idea how to answer that one. So I'll respond to Katja. I think the narratives point is really important and really helpful, and I think almost provides also a next step for where we take this work, including in MIDEQ. So it's really nice to kickstart that discussion today and to really show the complementary role that migration and social protection can play in managing risks in households, in meeting life aspirations of families, and how important social protection can be, not just in the here and now, and in managing helping households to get by during risky situations, but also in having more productive and meaningful lives in the future. So I really liked how you made that point on how social protection can actually help help migration become less risky and more effective for households in a way, more beneficial. So that's I think an area we should explore further. On the restrictions of movements, and of course, a lot of the studies on conditional cash transfers also showed that very same point that you also made, Heaven, that people stay behind in order to meet the conditions. But again, I think we need to then look at the time frame, and in the short term, people stay behind, and then maybe in the long term, people then leave once they are no longer restricted by these conditions, or no longer receive the program. Also in India, a lot of the studies on NREGA found that maybe people were willing to stay behind in the rural areas for the X number of days per year where they did have access to public work schemes, but then once that was finished or used up, then they still continued migrating. So I think, again, that point around not just looking at the immediate term, but also looking at the more medium and long-term effects. I think you also asked about rights, and I would say that we didn't really explore that point very much in our study, because we just basically reported what the effects are, and didn't really look at what are people's rights to receiving social protection in different areas of the country, or also their rights in relation to freedom of movement. So again, that's something we could explore further in the next aspects of the work.
Thanks,
Jason, over to you.
Thank you.
Thanks, Jessica. I don't know if I have a good answer to the internal migration. I might have an answer, but if I understood correctly, Clara, your question was on whether there was a correlation between social protection programs and the ease of access of those programs in rural areas and then rural urban migration. So in general, just to recall what we found on internal migration, we don't really find any leaning towards one way or the other. It was 17 studies found a decrease in migration, 18 found an increase. So there's really no difference across those. I don't have a very pinpointed answer, but the point that I kind of glossed over at the end of the paper on the implementation speaks to that issue in particular, because there were at least 2 papers that discussed how they find an outcome on rural migration, rural to urban migration, whether it's increase or decrease, but then they qualify that by saying the program was very poorly run, and part of that problem was the capacity of people to implement the program correctly and the access of that program in rural areas. And so there's definitely a discussion around that, and it likely mediates some of the at least the internal migration effects that we find. I want to say something more generally also about Katja's points, and it's taking a step back. It's not answering directly. It's really about the narrative of this whole discourse, this whole discussion. And I think the value added of these papers, and I guess of our paper, which amalgamates them all under one roof, is bringing together another step on our understanding towards the determinants of migration and the links with constraints, financial constraints, and these kinds of things. And it really helps us understand where migration is heading, because we know certain things. We can already foresee that, take Africa, for instance, where things are super dynamic at the moment, and there will be dynamic for the next 30 years. We know that people are going to be much more mobile because they're young. They're going to be much more educated. They're going to be wealthier. So we know that migration is going to increase on the continent. What we don't know much, or we misunderstand, is what the role of policy is in that. And I think it's really important beyond social protection, but also for social protection, understanding all of these different policy areas that are being rolled out in developing countries at the moment, and even in richer countries, what that's going to mean for the future of migration. Because there's certain things we're pretty sure about how things will move, demographics, wealth, and things like that. But this paper, really brings home the idea that we're not really sure what social protection is going to play, if anything, what role it's going to play in this. Well, actually, we do know that it has a role. We're just not sure which way it goes, because most studies show an increase or a decrease. It's the predominant impact is not no impact. So it's really important to dig a little bit deeper, not just in this field, but in other fields, to understand what is going to happen. And it's not to say that we should have or shouldn't have migration, or we should decrease it or increase it. It's really to understand where we're going, because those have policy implications themselves on people's livelihoods, on well-being, and so on.
Thanks, Jason. That's very helpful. And yeah, that nuancing of the discussion is clearly just the beginning of a conversation about the narrative as opposed to the end. I wonder, Clara, if I could just bring you back to the question that we had from James about the sort of portability of social security benefits, and maybe explain what 97 and 143 are as conventions for the rest of us that don't know. Thank you.
Yes, okay, thank you very much. So let me say the full name. Convention number 97 is the Migration for Employment Convention, and number 143 is the Migrant Workers, and between brackets, Supplementary Provisions Convention. So both these conventions are what we call the migrant-specific conventions. They're really focused on migrant workers, and they include provisions on social security. We also have a whole lot of other conventions and recommendations, for example, social security conventions that target all workers. But unless it's explicitly specified that migrant workers are excluded, all these conventions apply to migrant workers because they are also workers. But these two conventions that were mentioned in the chat, the two numbers are, so 143 and 97, are really specific for migrant workers. Both of them promote, Convention 97 promotes the conclusion of bilateral labor agreements, and its related recommendation number 86, even has a model bilateral labor agreement in its annex. And then we also have a social security convention, the Social Security Convention 157, and its recommendation that goes with it. And in that recommendation, we have in the annex a model social security agreement. So we have many conventions, not just these two, that promote the conclusion of bilateral labor and social security agreements. And as I just mentioned, we even have model agreements with really very useful guidance on how to basically what to put in the agreement, how to organize coordination between countries with a provident fund and countries with a social insurance system. As the ILO, we, together with our sister organization ISA, we provide support, technical advisory services to countries who request support on concluding and developing social security agreements. We have published a guide in 2019. I can put the link in the chat that has a chapter on social security agreements, including a 9-step process that we identified based on our experience and also on experience we found in literature, but mainly on our own experience. So it defines the 9 steps that we usually see in negotiations, and it also talks a bit about what the convention says in terms of content, what should be the content of the agreements. And so in practice, currently, the office is providing support a lot for multilateral social security agreements. We're supporting ECOWAS, we're also supporting SADC and EAC, although they are looking at having non-binding kind of social security frameworks, and we're supporting ASEAN. In the past, we've also supported individual countries. And besides social security agreements, we also support our constituents also developing laws and developing schemes and implementing those schemes, and also on the statistics. So it's not just focused on social security agreements. Thank you.
Thank you, Clara. If you could put those that information, that report that you mentioned in the chat, that would be very useful. Thank you. We have a question, one more question now from Stephen. Hi, Stephen. Lovely to see you here. He asked Jason, Jessica, if you take out the Mexican studies and perhaps also the India, China, South Africa ones, that's a large number of the studies, I guess. Does it change the tenor of the results across the rest of the literature? Thanks, Stephen, for the question. You're very welcome to add to that question if you, but I think it's very clear. So Jason, Jessica.
So we worked on this paper for a long time, and I do remember discussing exactly this at one point, but I don't remember if we did exactly what you're proposing now. But I think especially for some of the specific interventions, we do know that specific countries are driving the results. I would say conditional cash transfers. I don't know if we can actually say that these are that the trends are driven by Mexico, because these are the type of interventions that are found in a lot of different contexts. I think the one intervention where we did see that one country is driving the results, it's for unconditional pensions in South Africa, where we found that increase in migration by other household members of the pensioner who's receiving the pension. And I think there were about 6 studies on that, all on South Africa, and actually most of those were also exploring this really interesting gender dynamic, which found these effects mostly for female pensioners with female migrants, and that was also then often linked to actually the pensioner then providing childcare, and often didn't find the same effects for men, interestingly, but yeah, that's a detour. Just that was a really interesting finding, and I think that's the one example where I can confidently say there was one country driving the particular findings. And also I think that was one of our clearest examples by intervention.
Jessica, can you give us a sense of the countries outside of those countries you've mentioned, South Africa, India, China, where most of the other studies are coming from? Because of course, as with a lot of research, it sort of depends where you look, right, as to what you see. And I'm just wondering where the other countries are, because I imagine there are countries, many countries with social protection programs, which just don't happen to have research on this relationship, right? So I wonder if you could say something about the countries, because are there countries with big social protection programs and big out migration that don't have any research that might, if you were to include them in a study, if they did have research, would change things?
Yeah, so I think we have 23 studies on Africa, and I think about 6 of those are in South Africa. So of course, there's a lot of countries and a lot of interventions in Africa which have not been studied. There's a few on Ghana, like 2 or 3 Ghana, 2 or 3 on Ethiopia, and then the rest are really scattered across very specific interventions and countries. Also on Asia, the evidence is really sparse. So Asia is a continent where the expansion of social protection has probably been going on for a lot longer than in sub-Saharan Africa, and where we have quite a few countries with quite expansive social protection systems. And outside of South Asia, where we have 10 studies, and I would say maybe half of those are India, we have just 8 other studies looking at East Asia and the Pacific. So we have some regions that are clearly very understudied, and where we also know there is a lot of migration that's going on. So for example, taking one of the MIDEQ countries, we have the Nepal, Malaysia corridor as one of our corridors, but we also know there's a lot of migration from Nepal to the Gulf. Nepal is also a country that has had a lot of different social protection interventions over the past decade or two. Some are at a kind of universal level. So again, like things like pension. And we didn't have a single study on Nepal. And it's something we've tried exploring with some of our qualitative data for the MIDEQ project, but we actually don't have very systematic evidence on that at all. So yeah, the evidence gaps are huge.
That's a really important caveat. Thank you.
Yeah.
Before I turn to Jason, Stephen, I noticed you're on camera, so did you want to add anything? You're on mute.
I just wonder if you note any of that in the paper or in some version of your paper, because I think those are very important. The pension scheme in South Africa, I think, is very particular as a form of social protection. And so you wouldn't find other studies or other countries which would have that sort of process. Mexico, part of the reason I asked the question is because Mexico is right next to the US, which would suggest that migration from Mexico is more likely whatever kinds of social protection systems they have. South Africa is very far from any of the countries where South Africans are likely to go to get better job possibilities and so on. So people just don't go. Poor people do not go. Mostly middle-class people emigrate. And so I just wonder whether you're thinking about those geographic issues as well as the other ones that you've talked about, and what happens when you take them out in the way that Heaven was suggesting. Look at the other countries, or at least point to the need for people to work on these issues in those other countries.
Yeah, I think we do point to the need to actually expand the evidence base and across geographical context. I think much more than that, we also point at the need to really dig deeper into those mediating factors that tell us why we are finding particular patterns, because that is really the area and the evidence that I would say is most new, and that we didn't really have when Carmen and I first looked at the question 10 years ago. Jason had one slide on the design and implementation factors, and there were maybe 2 or 3 studies in the end that could really tell us something about implementation, for example. And of course, we know it's super critical. So I'd say, of course, important to look at more context, but really to look at those mediating factors, especially design and implementation, is really important. And on Stephen, in terms of some countries being located quite far from other countries where they might migrate internationally, keep in mind that we were also really interested in internal migration, actually. So that's why even in a country like South Africa, looking at migration is a really relevant question.
Thanks, Jessica.
It is very relevant, but there's been internal migration in South Africa for centuries, long before there was social protection. So, I mean, you've got to look at that context, is what I'm saying, which you obviously know.
Good. Thank you, Stephen. Thank you, Jessica. Jason, did you want to add anything to the comments that Jessica made?
Yeah, maybe just to add that, I mean, there's only a certain number of ways we can slice the data before it just becomes irrelevant. We're talking about so few papers. If we were, I mean, the one area, and we discussed this, Stephen, this is obviously an area, as Jessica said, that we discussed. I think one thing we could do is look at the African papers, because there's 23, and we could see if we find something on that end. The other thing is, your last point, I didn't follow what you were trying to say, because yeah, the context is important, but regardless of whether there's a long history of migration or not, might not necessarily be related to the fact that it has an impact with social protection, right? So two households, one receives the social protection, one doesn't. They both have the history behind them of being in a country that has lots of internal migration, but we're interested in specifically in whether social protection interacted with that. And I get that the history might interact with that, but that's really, really hard to identify.
Sure.
Maybe they're in certain quarters where
it is hard. I agree.
Thanks, Jason. I'm conscious of time, and for many of us, it's late on a Friday afternoon. So what we're going to do is we've got no more questions specifically on the chat or nobody wanting to put their hand up. I know Carmen's had to leave us. So what I suggest is we do, one last in reverse order points that anybody might want to make or additions, anything they haven't managed to say so far. I think there's been lots of potential follow-up pieces of work on this, and the MIDEQ blog series is open to anybody who wants to contribute some thoughts on these issues from a slightly different perspective, or looking at some reflections on different aspects. So please bear that in mind. Maybe Clara could start with you, and then work my way backwards to the original speakers, and we'll just do some final concluding comments and remarks. So Clara, thank you again for being with us. Anything by way of conclusion?
Thank you. I would say that by way of conclusion, as we also promote at the ILO, really to design any kind of policy measures, including social protection programs. When designing such measures, one should really take into account so many factors, including the labor migration and mobility landscape, the availability level and scope of social protection in countries of origin, but also destination, the heterogeneity and specificities of migrant workers, the sectors they work in, etc. This is also mentioned really in this study, and Jessica mentioned it just before too, that it can't just follow a simplistic approach where one would think that a social protection program would have a particular direct effect in a very, let's say, consistent way. So I think that I think would be for me the main conclusion that I'll remember. And thank you very much. Really very interesting.
Thank you, Clara. Much appreciated. Rogelio, still early in your day, I know, but we have really appreciated your contribution. I think everybody on this call will agree that the kind of detailed example that you were able to give us of your particular context and the work you've been involved in was very helpful. Anything you'd like to say by way of conclusion, any remarks based on the conversation so far, or that you would like to add to what you said very interestingly earlier on?
Well, thank you all for the invitation. For me, it was a pleasure to talk about these issues, and trying to synthesize my thoughts about it is that, in the context of Mexico, where migration is a recurring behavior of some groups, this phenomenon has to be taken into account in the design of the social programs, and specifically those related to or those who improve the well-being of the people. For me, the experience of Oportunidades, Progresa, Prospera is that once that people achieve these new skills and don't find in its place of origin the kind of jobs or the kind of life that they want to achieve, they will move. And in Mexico, there are, in some regions, as I told you, there are networks functioning that allow to the people to move inside of Mexico, but specifically to the US. And that's why some of the, maybe 20, 30 years ago, it was an unexpected result that investing in human capital was going to promote in some sense the migration. Well, I think that the evidence that gathered show that it may be the case people, and some of them want to achieve a better life in another place.
Thank you, Rogelio. I mean, the idea that we would want to stop people wanting to improve their lives for themselves and their families is absolutely an anathema to what MIDEQ is about. So that's a really important point to finish on, actually. Jason and then Jessica, just any quick concluding remarks by way of finishing up?
I think I already spoke a lot thanks a lot, everyone. This was excellent, and
Yeah, really.
looking forward to refining the paper and all these spin-offs that Heaven told us we would now produce.
Well, there's always more to be done whenever we do anything. It just reveals more to be done. Jessica, anything by way of conclusion?
I guess just as a researcher, I found it really insightful and really useful to have a discussion with Rogelio, because we look at these interventions on paper in some kind of analysis, and we just look at the numbers. And I just feel like having these conversations and understanding what was going through the minds of policymakers is just really, really helpful to understand what's really going on. So yeah, I'm really grateful that we could do that today. Really enjoyed it. And yeah, thank you very much, everyone.
Thanks, Jessica. Thanks, Rogelio. I think that opinion is shared by all of us. I mean, ultimately, a lot of what's written only scratches the surface of what's actually going on. And unless you talk to the right people who are in the mix at the time, it can be very hard to unpack some of these different elements. So really, thank you all. Thank you for your contributions. Thank you to those that have joined us from with outside MIDEQ in particular. I'm also grateful to Bendu Calon, to Cynthia Mokhtan, and to Catherine Jones, who were really very instrumental behind the scenes in making this event happen. Very delighted that we've got both the MIDEQ working paper and the UNU CPR discussion paper now available, and I hope that leads to other conversations of a similar quality to this one, because I've really enjoyed it. So thank you hugely. Enjoy the rest of your days if you're just beginning, Rogelio, and for the rest of you, enjoy the weekend. It's very nice to see you, and I look forward to seeing you again at another event very soon. Thank you.